My mother, Naomi Shivian Parker, was diagnosed with systemic lupus erythematosus at age 33. My brother Adam was 10, my brother Josh was 2, and I was 5 years old. And I was frightened, and I asked my mother, "Mom, are you going to die?" And she comforted me by saying, "I can live to the age of my namesake, my grandmother Naomi, who died at age 79. My mother died 10 years later at age 43.
She was a person who lived all the days, all her good days. I don't think she gave one of them away. And she was young and she wanted to live.
There were times where she was healthy and she was in remission, but they were far fewer than the days that she spent in and out of the hospital. And even though the ravages of the disease left her diabetic, left her with a loss of an eye, with staph infections that would never heal, what she did for us and my brothers was to be the best mom she could be.
When my sister-in-law passed away, nobody had ever heard of lupus. Nobody knew what it was. Doctors didn't understand it. They looked for every sort of thing that she might have had, but nobody thought of lupus.
Having had such a devastating loss, that's how we became involved.
No one has given more to lupus over the time of the last 40 years than Simona and Jerry Chazin. We need champions, we need leadership, we need people who stand up and say, let's get this job done. And because of them, we are.
The biggest progress we've made in the last number of years are in the number of people that are involved in research right now.
The first few groups of investigators that we funded were outstanding, and it created a kind of snowball effect where many saw this as a way to begin their career in lupus.
The Lupus Research Institute funds unconventional research, and I had an unconventional idea.
We're a lot closer to understanding this disease in a fundamentally important way that will allow better treatments for patients with lupus.
I believe that the explanation for how lupus starts will be a Rosetta Stone for all the other autoimmune diseases.
The focus on research, I believe, is essential to really find the next breakthrough for lupus patients.
Breakthroughs in lupus research can make an enormous difference. Millions of people suffer from lupus, and working with organizations like the Lupus Research Institute, we've been able to really make a big difference in this city.
We are so proud to honor Mayor Mike Bloomberg. What he has done for New York City so epitomizes the culture that we all can progress in.
I believe one of the basic government responsibilities is to give people the information they need to live longer and healthier lives. New York is the capital of innovation. This is where the critical mass is. This is where the best and the brightest are. And that's clearly true in medical research.
Research is our primary mission, but we certainly have the service that cares for our patients until we do have that cure.
There was like a whole year where I was just sick all the time and no one could really place what it was. I was going to the GI doctor, I was going to the allergist. And because I was running so many marathons, at that time, they were saying, you know, you're hurting because you're training so much, your knees hurt because you're running. But that was the stepping point to getting more tests done and finally finding out what was wrong with me.
My sister Kathy was a very funny person. She could be the life of the party. She would give you the shirt off her back. She was also a runner, and until she was diagnosed, she would still do her daily runs, even though she was completely exhausted. A year after she was diagnosed, she passed away from complications from lupus. It affected her heart. So I decided to run to raise money for lupus in her memory.
I think this is probably my retirement marathon. It's tough on my body. And if this is my last one, I wanted it to be really meaningful. And to me, running for a charity that's near and dear to my heart, to my health, then that's how I wanted to approach my last marathon.
It's very emotional for me because I feel really connected to her when I run. I run for lupus. I run from my sister.
It's been a long journey. To have no more lupus in the world would be a tremendous blessing to our family and all the families in this room.
And knowing those people and watching them fight the fight over the years has been very inspiring to me. And it's for all of those people as well that I'd be thrilled to see us finish this fight.